I have made you co-host. So whenever, because you mentioned you had a presentation, right?
Sure. Yeah, I'll share my screen and I will show you briefly just a brief presentation. Hi, everybody. My name is Dr. Janet Monagle, and I'm the Assistant Dean of Pre-Licensure Medication at Northeastern University. So I thought I would just start off by, and you can tell me, Bella, if this is okay. I was just going to go over a little bit about Northeastern University and then answer any questions.
Yeah, that would be great. Thank you so much.
Okay, so Northeastern University has a BSN program. That's a typical traditional BSN program on the Boston campus. But we also have three other campuses that have accelerated BSN programs, one in Charlotte, one in Fall River, Massachusetts, one in Burlington, Massachusetts. We also have campuses where students can take some of the other courses, and one of them being out in California, where they're able to take some of the initial courses prior to coming into nursing in Oakland. So, what this presentation is really about is the Boston campus, because on the Boston campus, we are a school of nursing within Bouvet College, which is a school of health sciences. So it's a small college within a large university, and it has a lot of interprofessions, such as physical therapy. It has a rehab portion, it has a PA section, and it also has health sciences and public health. So you can see that the School of Nursing is the largest out of those schools, but it is part of the Bouvet College. Oops, there we go. So the one thing that is near and dear to our heart is our mission. This mission has been revised in the last 3 years, but you can see that our mission of the School of Nursing is to make significant contributions to health in the discipline of nursing by advancing science, demonstrating leadership and innovation and practice excellence, and embracing the values of diversity, inclusion, and equity. We provide a caring environment to foster scientific inquiry and prepare students to become leaders, nurse scientists, educators, advocates, and clinicians to provide equitable and culturally competent healthcare to individual patients, families, communities, and populations, both locally and globally. So the faculty are, have a wide variety of specialties, but they all include this mission. And under this mission are these 7 pillars. And these pillars have been stable in the School of Nursing for many, many, many years. And those pillars are listed there: leadership, scientific inquiry, practice excellence, quality care, diversity, and maintaining their mission inside those pillars. So our curriculum is a little bit different from the standard BSN curriculum because we have both co-ops along with our clinical courses. So the co-ops are 6-month periods of time that are spent in clinical areas. But these clinical areas, you're not acting as a nurse. You're independently working, and most of the time it's as a CRNA or as something in the medical field. Then we have 6 clinical courses, I think, which is typical of most colleges, and one senior practicum. When you look at Northeastern School of Nursing, you can see all these different entry levels that we have. We have a very large number of programs within our School of Nursing where students enter in either at the ABSN level or the BSN level, and then they can also move into our master's program and they get a decrease in their tuition to do so. They could move into multiple pathways for primary care, for advanced licenses, or they can also move into leadership, DNP, and all the way up to PhD. One of the things that Northeastern is known for and committed to is program excellence. And we're not only a member of the International Honor Society of Nursing, but also a member of the National Hartford Center for Gerontology Nursing Excellence. We also are CCNE accredited, which just happened last year. So we have accreditation now for the next 10 years, or 9 years, which is very exciting to us. We're also approved by the Massachusetts State Board of Nursing. So our model for excellence, which may be different from some of the other colleges that you might look at, is mainly is it's a research intensive college. So there's a lot of research going on within Northeastern interprofessionally as well as outside of nursing. We have a very large engineering population as well. What makes us a little bit different is we also have that co-op experience, which are not required, but they are encouraged. They had been required previously, now they're encouraged. And the way the curriculum is set up is to allow for two co-op experiences, and you still graduate in 4 years. There's also the curriculum is set up for you to have a global experience if you so choose. You can move your courses around so that you could go overseas. We have a campus, we have more than one campus in Europe, and then we have short service learning trips that you could go for 4 weeks or 6 weeks or 8 weeks. So what makes us different, I think, is exactly that. Our curriculum is built around having students not only pass the NCLEX, but enter practice prepared. And practice ready means that you would have increased amount of clinical judgment and the ability to work within any school, within any clinical environment. So actually, we have a brand new curriculum that is starting in the fall that is based on the American Association Colleges of Nursing. 10 domains of learning. And I'm not going to go into all of those, but it is the 2021 Essentials of Nursing Education that were recently published by the American Association of Colleges of Nursing. And our accrediting agency uses these to judge the curriculum. We have a state-of-the-art simulation lab, 9 high-fidelity patient simulators, video capture technology, 4 simulation bays, and 3 debriefing rooms. There is actually, if you go on YouTube, you could actually look up the Arnold Goldstein simulation labs and you would see some YouTubes. We have global experiences that I explained. Some of them are called NUN. So sometimes the students start off their first year of a 4-year program overseas. Sometimes they go to Greece, sometimes they go to Ireland, and then they come into nursing in their second year. Then the Dialogue of Civilization was what I was describing. Next year, we have students going 4 weeks to China with one of our faculty members who comes from China, and they're going to learn a lot about public health in China. And then there's some alternate spring break opportunities, global co-ops, service learning with the faculty, and global volunteering opportunities as well. We have some students going to Guatemala for a 2-week period for a volunteering opportunity. So when you look at our curriculum, you can see that we have academics, which, along with co-op, prepare you for a stronger academic person, academic experience. And this is what we call ready, practice ready. The difference between co-op and clinical, sometimes people get confused, like, what do you mean co-op? So co-op, you're not paying tuition when you're on co-op. You're being paid by the agency. It's full-time employment. You're expected to work 40 hours and you receive experiential credit, not academic credit. And it's unique to us, Northeastern. They're well known. They've been doing this for, I don't know, more than 50 years. And then clinicals are non-paid positions that are part of academic, they go hand in hand with a didactic academic course. Usually it's 1 day a week, and grades are awarded, and it's required by all nursing programs. And these are our clinical partnerships. We work with the best hospitals in the world. All of our clinicals and pediatrics are at Boston Children's Hospital, which is world renowned. And then you can see the other places, they all have their areas of expertise and they are world renowned institutions. Units available for co-op. Students go to co-op usually at one of those institutions that I just showed you, and they pick between different areas where they work as like a certified nursing assistant. But what that does is it gives students a lot more ability to feel confident when they get into their clinical areas. Here's a sample of what it might look like. In the fall, year 1, you take classes and labs, classes and labs. This is all like your prerequisites. All of your all of your science classes. And then there's this little summer too, which is like about 6 weeks, and that's a vacation or a global experience if you choose. And then you come into year two, you take fall classes to December, and then you're in co-op from January to July. And then classes start up again. You might be summer two classes with fall classes. And then again in the fall of year three, you take classes in clinical, go back on co-op, etc., and graduate down here in May. And that's really it, just a high level overview of our curriculum, and I'm happy to answer any questions.
Thank you so much for sharing. So if anyone has any questions, you can either put them in the chat or unmute yourself, but we also prepared some questions.
Sure.
So a lot of so UCSB doesn't have a nursing major, so a lot of students are probably going to do the ABSN route. I think a few might transfer to a 4-year, but I think it's more common for the ABSN route. So for that program specifically, when people are applying, will you take in progress or online courses, or is that program like you want all of the prereqs completed before you apply?
Yeah, so they have to be completed before you start the nursing courses in the fall. So the ABSN, I wonder if I have like a picture here that I can show you of that. I'm sorry, I misunderstood. I thought you were looking at the BSN program. But anyway, for the ABSN program, we start the new program in the fall. And it is, you won't go into clinical in the first semester. What you do there is we have a lab, and we've extended the time of that lab and that didactic course so that you feel better prepared to go into clinical the second semester. In the second semester, where you do your clinical there would be adult one, we call it, with psych. And then in the third semester, you do PDOB and adult two. And then in your last semester, you do your final practicum. So, and public health as well. So the way the new curriculum is set up in our ABSN is it moves fast, but it's set up so that you're prepared well by having that first semester not in clinical, but mostly in lab and simulation, so that when you get into those last 3 semesters, you feel more prepared. So our ABSN is 16 months. All of your prerequisites, you need to have, you can enter 2 ways. You could have 62 credits and no BS. You don't have to have a bachelor's degree. You could have actually just 62 credits. And you have to meet the science requirements, which I don't have them in front of me, but they're online. They have the A and P micro, all of that. Before you enter, you would have to have that sent in to our admissions people. So a lot of people are taking it in progress. They're admitted to the program. They're taking it in progress, and they have to get a B by the end of the summer before they enter in the fall.
Okay, thank you. And then I know that you mentioned that because I was doing some research and looking on the website, and then there's the campuses in Burlington and Charlotte. Is there a difference between programs, or is it just you have two different locations where you can go?
So they're all the same program. There's actually a third campus now in Fall River, Massachusetts, which is in the southern western part, closer, not really west, but southern middle part of Massachusetts. So all of the programs follow the same bachelor's degree program that I was telling you about. Okay, so if you take adult one in Boston, you're taking the same course in Burlington, Fall River, and in Charlotte. The difference being is the delivery. So the delivery is all online for the ABSN program, and it's all in person for our BSN program. Okay. So when I say online, your tests have to be in person. I mean, you have to come in, so it's really hybrid. You have to come in for exams, you have to come in for clinical, you have to come in for labs. So the way the ABSN program is set up is you have the option of extending your period of time and actually doing a co-op if you want. But most people who come in with a previous bachelor's degree are not interested in extending their time. They just want to get it through in 16 months. So we understand that, and there's no requirement for a co-op, but we do have some students who decide to stay and do a co-op because they don't feel as confident in the clinical area, so it gives them that extra confidence. I would say to you, as far as the different campuses, whatever you take in Charlotte, you take the same in Boston. So it really is your decision. You're all coming from California?
Yes. Yeah.
Okay, so um, as I said, we have a unique program in Northeastern. I think we're the only one in Massachusetts that allows people to come in at 62 credits without a bachelor's degree and then take the same credits as the people with a bachelor, take the same nursing school with the same exact program, except for an additional English is required. Because Northeastern has this English program that they require for people without a bachelor's degree.
Okay, thank you. And then if someone was looking at the three different campuses, can you only apply to one or could you apply to all three or just two?
Yeah, it's the exact same process for admission, except for a different person might review it. So I would say you could apply to one and then change your mind and move to a different campus. We do have an overwhelming number of applications, and we have a rolling admission. So we try to take like say you applied and it was full for the fall, they may admit you for January. Do you know what I'm saying? So it's the earlier the better to apply. But say you applied for Burlington and you decided, oh, it's cheaper to live down by Fall River because it is, and you decided you wanted to go to Fall River, then you could request that transfer.
Okay, thank you. Um,
Sure.
and then we created a Google form for people to ask questions, and we got one that was asking about some of the requirements for the ABSN program, and then they wanted to know what should I be doing to have a better chance in being accepted? Like when you're looking at an applicant, is it like holistic or more academic, or like what are you guys looking for?
There's a very strong correlation with success in nursing school with science grades. So what I would recommend is that you work hard to get good science grades, good grades, B or better in your science courses of micro A and P. Not to say that we don't accept people with a C, because some people, a C or a C plus is transferable, and perhaps it was just one course, and that's still okay. So it is a combination of science grades and then overall GPA. And then, of course, it actually, even though I know a lot of people probably use Chat GPT for their essay, but it really does count for something to hear people's stories of why they want to become a nurse and how they want to get into nursing school. But primarily, we're looking at me, and I review a lot of different applications for different campuses. I'm always looking at my science grades because I know that research tells us there's a strong correlation between your ability to pass and do well in a science grade and your ability to pass nursing courses.
Okay, thank you.
Okay.
And then can you tell us a little bit more about like for the ABSN program, like the NCLEX passing rate and like because I know we've spoken to a few schools where they have the exams are formulated in a similar way as
Yeah.
like NCLEX questions. Is that kind of what Northeastern does, or how do you prepare students?
So I will tell you that we have just switched vendors because, our NCLEX pass rates are fine. I think we're somewhere like 88 or 90. I mean, we've never had, I sit on the Board of Nursing in Massachusetts. And so people, schools are put before the Board of Nursing when they're less than 80. And of course, Northeastern, that has never happened. It's never been an issue where there is, lower than 80%. We're closer to 90% in all of our campuses. But I really, as the assistant dean, I didn't think that was good enough, and I didn't understand why we weren't higher because the students we have are incredible. We have such really high achieving students on all of our campuses. So we did recently switch to ATI. I don't know if you know anything about Assessment Technology Institute. It's called ATI, and it is an NCLEX prep company. So students will be required on all campuses to pay for the services of ATI, kind of like a textbook. I think it's around 190 per semester for the ABSN program times 4 each semester. And what this gives you is standardized testing that's rating, and They use AI to give you an individualized plan of where it is you need to focus. And so it really is an excellent, I mean, the schools that are using it now are almost 100%. It really is an excellent kind of like a, you know, kind of just an extra push. We know our curriculum is good, but these people that run these companies for NCLEX prep put thousands of dollars into research to find out what exactly should be on the NCLEX, right? What exactly they think should be on. So we figured it was best to partner with them. And because we have such a large number of students, we have almost 1,000 undergraduate students, I mean, pre-licensure nursing students, they were able to give us a really reasonable price, like a textbook. So so we will be starting that in the fall. And so not only do they do a standardized test, which will be done every semester, every semester, or in the first semester, we'll be doing a test taking. They do a 4-hour test taking strategy. And then in the last semester, they do a 3-day live review that reviews everything, all systems that are on the NCLEX. So they'd had really good success. So we did bring them in because we feel like we could use that with changing to a new curriculum. We feel like we really need to make sure that the students have success on NCLEX.
That sounds great.
Yeah.
Thank you. And then, so we got a few questions in the chat. One of them was asking about the, day-to-day workload, because I know a lot of students, unfortunately, they, have to work. And a lot of
Yeah.
these schools say, like, we don't want you working because it's really, intensive. What, is like your opinion, or how do you think
Hmm.
someone who, needs to work can balance the intensity?
It is, I'll just tell you, it is really hard. And the reason is because remember, it is an accelerated nursing course. So you're taking, you're taking courses that used to be spread out over 6 months in three. So, I know like we have students that do work and that have to work, and it's hard. I mean, that it's hard for me to say, okay, you can work 20 hours and you'll be fine. It's not true for everyone. It really depends on what kind of student you are. And maybe an accelerated program is not for you if you have to work a lot of hours. You're better off to take it slow and do a longer program. That's what I would say to you because I have seen students and the uncertainty of when your clinical days are. There's uncertainty there. So it's hard to work a lot of hours. I mean, I think anyone could work some hours, but you have to get your schedule and then you have to figure that out. And so I would highly recommend that you do a slower program if it's someone that has to work more than, 15 or 20 hours.
Okay, thank you.
Okay.
And a question in that, similar field is someone was wondering, the balance between tests and clinicals. Like, is the program a lot more test heavy, or clinical heavy? And then
Yeah, so
yeah.
so the new so that's a great question because the new standard for nursing education is to move towards what we call competency-based evaluation, which means really it's doing more than it is assessing via a test. So we're in the process of moving some things more towards having you practice and having you present and show exactly competency in certain areas. But still, nursing courses will maintain at least 80% of your grade is going to be at least 80% is going to be associated with test taking because you have to pass the NCLEX. And so we haven't, I know some schools are moving towards 50%. We haven't made that move. We've gone from 90% and we're moving towards 80%. So it would be 80% of your exams. And that's why we do feel strongly that 20% can be like partially with the standardized testing and maybe a concept map or a care plan, but we're still practicing with exams and quizzes.
Okay, thank you.
Sure.
And then so we had another question. Sorry, they're kind of all over the
That's all
place
right.
as they come in. Someone was wondering, do you have partnerships with local hospitals?
Hmm.
What is the job secure rate, and do you help students find
Oh
places?
my goodness. There is such a nursing shortage coming down the pike. If you guys go into nursing, you have nothing to worry about. Trust me, I entered the nursing field in the early 80s. I actually moved out to California. I worked in California at a trauma center in Southern California, and I got great experience. I have never, ever not had a job. I mean, I have never been said, oh, we're going to lay you off. None of that ever has happened in all these years. And that's in the early 80s. I think you are entering at the field at the same time, similar to what I entered, which was a nursing shortage. And so you'll be able to probably have your choice of jobs. And in Boston area, the partnerships we have are incredible. We have people coming to us now and presenting about nurse internship programs that they're offering. They want our students to come. We have students already have secured their jobs and haven't passed their NCLEX yet. So it's not an issue in our area of the country. I don't know in California if it is, but there is a shortage and we have a lot of great community partnerships. I don't think you would have to worry about that at all.
Okay, great. Thank you. And then on top of that, do you know, because I know some hospitals offer programs where if you agree to work with them for a certain amount of years, then they'll help pay for your tuition. Do you know of any local hospitals that do something like that?
Um, we don't have any hospitals right now that are offering that I know of. The only thing I would say I wonder if the federal, we have a real strong relationship with our Veterans Hospital, and I'm just wondering if that, so I think there's some federal loans. If you have federal loans, I do believe that you can, work and work out something that way. And I do believe that if you work at a federal institution, that it counts. But I am not certainly not sure of that. The only thing I know is that the Veterans Administration in Boston is always looking to hire our students. And I think that's probably one of the drawbacks for you if you already have a bachelor's degree, is that you're not eligible for some of the loans that you would be eligible for if it was your first bachelor's degree. So no, in Massachusetts right now, they give tuition reimbursement if you were there. Like say you wanted then to go back and get your master's degree, they may pay for some of your courses that way. And I'll tell you, if you decide you want to teach, then a lot of times you can get a doctorate of nursing or a PhD without paying anything because, like we have, I think I have five of my faculty are in doctorate programs right now. They're not paying any tuition and they're going to get their doctorate from Northeastern. So there are other ways, but I don't think there's a way to pay for your undergraduate.
Okay, thank you.
Sure.
And then another question, direct message to me. What type of volunteering slash jobs should we do right now to look good for applications or to, get more experience or get ahead?
Yeah, I really think if you could get any kind of a job within a healthcare system and that anything, a lot of when I review students' applications, a lot of them have worked as CRNAs, but you don't have to work as a CRNA. Some people have just worked in a physical therapy department, all different, any kind of a healthcare where you can show that you have good communication, some compassion. I mean, people, you don't want people don't go into nursing for the money. Although we have job security and we have decent pay, people go into nursing really because they want to help people. And so if you can somehow show that in your application process, that that's really what your motivation is and that you have thought of that, as you're looking for work, I think it really adds to your application.
Okay, thank you. Um,
Sure.
and then another was, so back to the test taking, are there strategies in place to help students who fail an exam or fall behind, or like, if you notice a student continually struggling, are there ways that you guys support them, or how, like, does that work?
Yeah, so the ABSN, the ABSN is a little bit different because it's online, right? So it all is running online. We require that our faculty have office hours, even though it's an online program, right? So, yes, we always recommend a student who's struggling, and we do have a dashboard that we watch to see if students are struggling. We have great advisors on each campus that reach out to students and offer them. We have tutoring, we have peer tutoring, and our faculty do exam reviews. and to make sure to help students. But honestly, students have to be their best own advocate because we have the resources, but if you don't ask or utilize them, you don't get them. We have a lot of resources that we offer students, and a lot of students don't take advantage of it.
What would some of those resources, like examples, of things
So
that,
we have a part, so our ABSN, we partner with another company called Orbis. And so Orbis, what they do is they um, have they maintain our equipment. They have office people that open and close our campuses. They have people who operate our labs, order our lab equipment, etc. So they also have a whole nursing department that does tutoring. And so they offer tutoring sessions based on content that we're teaching right now. The other the other, like I said, the other resource is always your faculty. Even though it's an online course, faculty only have 24 students in their class. So they should be reaching out to their faculty. The faculty should be doing some individual review with that student to help. And then, of course, there are peer review situations where students can ask for a peer to help them review, and there are upperclassmen that might help that. We have open lab hours in our lab that you could choose to go to or not. You know what I mean? To practice certain skills.
okay, thank you.
Sure.
And then another question, back to admissions. What are common reasons that you see competitive applicants get denied? And then again, how much is GPA weighted in versus extracurriculars, or is it kind of dependent on the cycle and who's applying?
Yeah, so for the ABSN program, it's not as difficult to get in if you meet all the criteria that they're requesting. So extracurricular is not as important in the ABSN program as it is to have a GPA. So your GPA, if you have a borderline GPA, you should I think the best thing to do is to do the best you can in those prerequisite science courses because I have had students that have come with, they haven't done well in college. They fooled around for the first couple of years. They had a D and an F. You know what I mean? But then they come and they take their prerequisite courses and they get A's and B's. I still would let them in. Do you know what I'm saying? So it's not as difficult to get into the accelerated BSN because you've already proven that you can get a bachelor's degree, right? So it's not as competitive as the as the plain BSN program. But if I look at your, if we look at your admission work and you have a great essay and you have recommendations and your GPA is borderline 2.5 and your science grades are still a C, I probably wouldn't. That would be a student that I probably wouldn't want to accept, not because I wouldn't want to give you the chance, but because I wouldn't want to take your money. You know what I'm saying? I would worry, Northeastern is not cheap. So we want to only accept students that we think can manage this fast-paced classes. So you have to remember, you have to be able to focus on the courses, and it is fast-paced. And after the first semester, you have two clinicals, you know, every other semester. So it's busy.
Okay, thank you. I think that information is very like reassuring because I know that's a lot of the questions we get is like, how do I be competitive? What if this happens? So just hearing that I think is really reassuring to a lot of people.
Good.
And then yeah, as a reminder, if anyone has any questions, feel free to unmute or put it in the chat. And then I guess just a question for you is, looking back at like your whole journey into nursing and all of that, do you have any advice for people considering nursing or things that you wish, more students would know about the field? If like something
Honestly, I can honestly tell you that I've been a nurse for over 40 years and I have never, ever once regretted it. And I am the type of person, as I told you, I started my career out in California. I did trauma care. I worked in ICU for 7 years. Then I went back to Massachusetts. I worked in the emergency room. Then I worked in hemodialysis. Then I worked in home care. Then I worked in hospice. Then I started teaching. So I have moved around and done different things because that's the type of person I am. I wanted to have a variety of expertise. So I feel like the thing about nursing is if you get bored with a job, like if I was doing something with insurance, I couldn't do it for more than a couple of years. I'd have to move out, right? So if you're the type of person that really likes to change it all, I think it's a great profession because there's a lot of opportunity for change. And if you're the type of person that likes to stay in one place, I mean, I was 17 years at one place where I was teaching because I loved teaching at that place. So I think I would never regret it. I love teaching and I went straight through and got my PhD. I started out in a nurse practitioner program after I had my bachelor's degree, and I left the nurse practitioner and went into education. Sometimes I look back and say, maybe I should have been a nurse practitioner and then teaching. That's the only thing that I would say to you is I think if you can get your advanced practice license, I think it's really worthwhile because when I went to school, you had to practice under a physician, and it wasn't something that I really wanted to do. I didn't feel like I could really do nursing the way I wanted to do nursing. Right now, though, because of the pandemic, Massachusetts has passed a law that you could, as an advanced practice nurse, you could practice independently after 2 years of being under a physician. And this is actually in many states right now. So I would say to you that that would be my only change. If I knew that change was going to happen, I probably would have gone for my nurse practitioner license as well. So consider that there's so much opportunity in nursing right now. I think it's a great profession to get into, and it gives you a lot of flexibility and decent. I don't know. I remember when I moved out to California, the pay was really much better than Massachusetts. I don't know what it is now, but what part of California are you in?
We're all in Southern California, Santa Barbara, because we're all
Oh, okay.
UT. So,
So you're really not that far from where I was.
where were you working?
Mission Viejo.
Oh, okay.
Yeah. That's
Mm,
only about 20 minutes, right? Or 30 minutes?
I'm not sure.
Oh, okay. It's south. Yeah, I'm trying to think of it. I don't even remember where it's near. Were you guys near the fire?
No, we were a good 2 hours, I think, because it was more
Oh,
toward.
good.
So we were good over here.
Oh, that's good. That's
Yeah.
good. Well, reach out if you have any questions. I'm happy to answer any questions. But even if you don't come to Northeastern, I think if you're thinking of a nursing career, I think it's a great thing to do.
Thank you. So then one last ending
Sure.
question based on what you said. So is it, because I know nursing can be very flexible, like there's so many different types of nurses. If you were to get your, advanced practice in a specific specialty,
Mhm.
is it then like you're kind of locked into that? So like if you were in peds and you wanted to do family, like is it harder to switch once you do all that schooling?
So it's funny that you say that because it's come before the Board of Nursing in Massachusetts just recently. We had a family nurse practitioner who was treating psych patients and writing psych prescriptions. And someone reported her to the board and said she didn't have the credentials, blah, blah, blah. But she came to the board with evidence that she had continuing education in psychiatric medications and that she was prescribing, et cetera, that she had done so many CEUs and everything. The board said it was fine. So the board did not find her in violation of any of the Nurse Practice Act or any of the scope of practice laws. So I think if I were to do it, I would probably go family because family is broader and allows me to do pediatrics or adults or geriatrics or even now with this person she went and did more information on psychiatric drugs. So for me, I probably would do that, but it is more credits to do that. So I understand if someone knows they love pediatrics, I think you can do it and you would have to go back to school though to change to psych or to change, you know what I mean? So yeah, I think that the scope of practice laws vary from state to state. So depending on the state, you would be in one area. The one thing I would not recommend is doing like acute care nurse practitioner, because then you can only practice inpatient. And you know what? You might get sick of that, really. Especially where the predictions are when we look at nursing across the United States, the prediction is that we're going to be moving out into the community in the next 20 years, right? We're going to be 85% in the community 20 years from now, is what they say.
When you mean going into the community, what would the difference be between, for
So,
us who don't know
so
what that means? What?
Oh, okay. So I guess what I'm trying to say is, right now the acute care hospitals they're all combining. I don't know if that's happening in California, but there's all this change going on within the healthcare field, and there's floors that are closing and hospitals are combining, and patients are being pushed home. So patients are being pushed home faster than we've ever seen before, and patients are being cared for in the home sicker than ever, right? So when I say out in the community, I mean nurses are taking care of patients in their home rather than an acute care setting because the acute care settings are closing. I mean, we're having a lot of trouble with the acute care settings because the funding, the funding is difficult right now, what's happening in Washington, D.C. So what we're going to see, I believe, and what the predictions are, is that more care, more nursing care will be happening in patients' homes.
Okay, that makes sense.
Okay.
Thank
Yeah,
you.
sure.
So, are there any more questions or anything anyone wants to know before we wrap up? Okay, I'm going to take that as a
Okay,
no.
so tell me a little bit, Bella, quickly about your organization.
Oh yeah, we started fall of this past year.
Hmm.
So we're currently in our third quarter. We're educating people on the nursing field because we don't have a nursing major, and a lot of our pre-health clubs are pre-med, pre-vet, pre-dent. So there wasn't really any representation for nursing. So we kind of
Okay.
wanted to like show people that, there are students at UCSB who are pre-nurses. And we've had a lot of people come up to us and say, I didn't know anyone else was pre-nursing. I thought I was alone. So we're just trying to, help people figure out, how to get into nursing and just also help them meet other people who are nurses. Because,
Well, that's great. So do
yeah,
all of you think you're going into nursing?
yeah, I
Oh,
think
great.
majority of everyone in here is either considering it or is pre-nursing.
Oh, that's wonderful. Oh, that's nice to hear. So please reach out if you have any questions and I can help you. You have my email, right?
I do.
Okay. Bye,
Um,
everybody. Thanks for coming.
can I ask you, we got
Oh,
one,
sure.
sorry, we did get a last minute
Oh,
question.
sure.
So someone was wondering what you recommend people look for in a nursing program, like what makes something more attractive than another one, in your opinion?
So, what's most important is that you're able to get your license, right? So you've got to look at the NCLEX pass rates, which are published every year, right? So you should look at that, and you don't want to go to anyone who has on there, like I would say, less than 85%, I probably would not attend. Okay. Because that means, or at least, I mean, 80 is really the limit. So you have to be able to get your license. You also want to look and make sure there's nothing on the website that says that they're on warning from the Board of Nursing, because there are a few ABSN programs that are competitors of ours that are on warning from the Board of Nursing because they're not doing things the way the Board of Nursing wants. So you don't want to go to a place like that. So you want to look at the website, and I think you want to consider the length of time. Like I know before I worked at Northeastern, I worked at Mass General Institute of Health Professions, MGH IHP, it's called. They went down to 12 months. So if you think 16 months is fast, 12 months is even faster. I don't think that's a good idea, but it might be something that's attractive to you. But I mean, you would be not be able to work, and I mean, it's really very, very fast. So I would look at the length of time, and then I would look at um, the ability to, I would say, the area of the country where it is, the ability to get a job, which I don't think there's a problem anywhere in the country that I can think of getting a job. And then, of course, you want to look at the cost. I mean, that's the problem with Northeastern. I hate to tell you, but it's expensive. I mean, I know a lot of colleges are expensive, but there's not a lot we can do, especially with the ABSN, because you don't qualify for a lot of aid. You know what I mean?
Okay. Thank you so much
You're
for
welcome.
answering all our questions and for the presentation. We really, really appreciate it.
Good. All right, thanks. Have a great day, everybody.
Yeah, thank you, you too.
Bye-bye.
Bye.